All right, hi everybody. I will go ahead and get started on how I would advocate towards an all-payer model on behalf of consumers in the state of Vermont. All right, so one of the most traditional healthcare payment models in the United States is the fee-for-service model that provides reimbursement to providers based on the number of services provided to a patient. Depending on the stakeholder, and particularly for providers, this model has certain benefits. However, it also certainly has challenges, many of which can be debilitating economically and for forging a healthy future for Vermonters. The fee-for-service model forces payers, be them patients or insurance companies, to reimburse providers for each service performed. There isn't incentive for providers and networks to implement preventative care strategies, to prevent hospitalizations, or even to take cost savings measures. As we work as a state to address this as an issue, it's important to quantify what it means for consumers. Data from the Center for Medicare and Medicaid Services, or CMS, tells us that 17.8% of the overall U.S. economy was dedicated to healthcare spending in 2015, an amount that equates to more than $3 trillion, and remains on a trajectory to rise as we head into our coming years. The Organization for Economic Cooperation and Development, OECD, conducted also a study in 2015 that compared healthcare spending across 13 high-income countries. In the United States, while being the only country that didn't have a universally funded healthcare program, was far and away also the biggest spender, spending more than 50% more than the next highest spender, which was France. This couples with the fact that the United States performs consistently and significantly lower in key health measures like life expectancy, infant mortality, and the prevalence of chronic conditions, which in and of themselves occupied 86% of our healthcare spending in the same year. That's $2.7 trillion. So to be concise, we spend massively more than any other industrialized nation on healthcare, and it doesn't even moderately keep our communities healthy. In fact, the largest portion of our healthcare spending is relegated to conditions that are far more preventable than any other kind of illness, and is often linked to lifestyle-based realities in our consumer base. We aren't creating healthcare opportunities for our citizens, we're providing ill care, and often it's more profitable for our providers to have patients stay ill. It's bankrupting our consumers, it's tying the hands of our government, and it's wedging insurance companies into narrow corners that drive up liability costs. To begin addressing this issue, the state of Maryland began in a pure and simple way to regulate cost, switching to an all-payer hospital model in 2014, and away from the fee-for-service model that we've traditionally seen across our country. In practice, that means this. Maryland is moving away from CMS payment per hospital inpatient admission. Instead, hospitals will be compensated based on Medicare per capita total hospital growth, and that growth will be limited to a fixed single-digit percentage that's controlled by the state to better align with other cross-market industry growth. Maryland will shift hospital revenues into fixed dollar payments for care, or sometimes referred to as global payment plans, meaning that a procedure has the same cost across hospitals and across insurance plans. Proposing changes to provider and network compensation will certainly face stakeholder resistance, particularly from hospital networks and individual care providers. That said, changes that better align the United States healthcare system with those of our higher performing, lower cost industrialized allies are imperative for our system to remain sustainable and functional. We've hit critical mass, it can't continue to grow. Here's how I believe an all-payer model can help constrain cost. 1. Lower operational costs. Our current reimbursement system carries high administrative costs for insurers and providers because it's opaque and different for every consumer. It's often confusing. 2. Expansion of health insurance markets, and hopefully this, okay? Small insurers have traditionally struggled to negotiate rates and really establish a network of care providers that appeals to a consumer base. In an all-payer rate-setting model, small insurers hopefully wouldn't have that problem, and hopefully that would increase competition and reduce the cost of insurance for the average consumer. And 3, service fee constraint. The costs for specific services would be regulated and formulaic in growth structure, making healthcare more consistent and predictable for consumers. In essence, an all-payer model has served as a wonderful mechanism for the state of Maryland, allowing it to experiment with a model that more closely mimics the models of other higher-performing countries. I believe it's a model that other states should prepare for and begin utilizing themselves for increased health outcomes and cost constraints for its consumers.